We're here today. We're going to be working on a TMJ today. So that stands for temporomandibular joint. It's the joint of the jaw. Temporo means temple. Mandible is, of course, the jawbone. So the TMJ is the joint there. Now the jaw works in that when you open it, it hinges down as well, but it also shifts forward. So the first thing and the main thing I check for, besides any shifting from side to side, is that shift forward. If it stays stuck, the joint actually should leave the capsule a little bit. So I'm going to check to see if he has that. If he does, we'll work on it. We choose to work on it with it's the lightest force we can use and actually get something done, which is with the Impulse IQ adjusting tool, and it just does a tapping sensation, and we use the lightest force setting for this particular adjustment. Okay, all right, let's open slow. Okay, and all right, and relax for a second. Now Les' jaw, when he opens, it shifts to the right side and the right side doesn't come out of the joint capsule like it should. So I'm going to work that. First, just getting right there on the mandible, driving it down. Now we'll have you open up slightly. Now more. Now more. Good. The beep tells me that we've achieved better motion. Okay, now open again. Alright, now it is still a little sticky in there. I'm going to come in. Got a little more force on that one. Okay, now open wide. And now it shifts forward. There's still a little hump there, but it shifts over and pops right down and out. So that's good. Now close. And now open. Wow, does that feel any different to you?
Yeah, a lot different on the right side especially.
Let's check the left. Now the left I didn't notice anything in particular yet, but I'm just going to use a muscle test to give me a little help. We test a muscle, test strong. We can touch an area. We've got here in the area of the masseter muscle and here that needs some work. So I'm going to do some light work on the muscles of this. I'll turn that down. I'm just going to kind of work that masseter muscle. Get just a touch of massage oil here and kind of work this masseter out. This helps, of course, blood flow, helps the muscle to not be in spasm. Does that hurt down there at the bottom?
Oh no, I feel good.
Okay. I'm not on your braces at all, am I?
No.
Okay. So the first part of the treatment, of course, we improve the motion by working on the joint. The second part here, I want to also improve its ability to move and function by working on the muscles. And this side's a little ridgier, a little more going on this side. The instrument I'm using, by the way, is our Vibracussor, and it does kind of a massaging type motion, but it also goes in and out very slightly, so it has the feel of a penetrating kind of massage, like it's going deep, as opposed to a lot of the over-the-counter massagers that you can buy that just go side to side. They don't go into the tissue at all. So it allows us to work a little bit deeper into the tissues. Of course, with that we have to be more careful. There, that smoothed that out quite a bit. Now,
That feels really good.
let's check. Now we're solid on the muscle tests. So at that point, I would conclude the TMJ treatment unless you're all set, man.
All right, thanks.
All right.